Good morning, everybody. Happy 2023. Welcome to our 2023 Zoomcast series. My name is Robert Crowder. I'm going to be one of the presenters today because it's presented by the Benefits Trust. With us today from the Benefits Trust, we've got Carrie Lane is with us. Carrie, give us a big shout out, big wave. There we are. There we are. Mike Ignatz is here, of course, and my son, Rob W. Crowder, is with us today. So on behalf of all of us at the Benefits Trust, we'd like to thank you for joining us today. If you don't have your camera on, we'd really appreciate it if we had your camera on. I know we've got some people from well, Dan Caswell is with us from Huntsville, Ontario. Anybody else far away? Not that Huntsville's that far, but anyone else far away? Anyways, doesn't matter, but I'd like to take this opportunity to thank everybody for participating today. An exciting day ahead. We're going to talk about knowing your corporate client and smaller groups, that's for sure. But let me just share my screen here. I want to make sure that I get the right one. That's it. Everybody can see that. There we go. So we want to talk about know your corporate client. You to a few profitable clients with 1 to 5 employees. And this is our case study edition, as we want to call it, the 2023 Zoomcast series. The idea behind these Zoomcasts is it's not about being the smartest person in the room. It's about being in a room where everybody gets smarter. It's as simple as that. So we would really appreciate it if you had your cameras on, and we want to make this interactive. So we want to hear your thoughts, your ideas, your stories, etc. The end of the presentation today, the next day or so, you're going to get a survey, and we'd love you to fill that out because we want to see how we did and how we can do better tomorrow. So if you fill out your survey and give us some feedback and other subjects that you'd like to see covered in future Zoomcast series, we'd greatly appreciate your feedback. As well as that, Mike Ignatz is going to send you a CE credit for participating today. And that'll come out in the next week or so. So we request your patience on that, and Mike will send it out. And it was interesting yesterday. I think a few of us were on that call, but I attended an advocacy call, and it was something that was put on by Advocates National, and they were talking about sales, and they were talking about all sorts of different things, but really about developing your business. And one of the things that was really interesting is the Financial Services Commission of Ontario put out a statement, I think it was in May of 2022, saying what are eligible CE credits. And in my opinion, and again, this is just my opinion, but what they presented in their meeting, which was not an hour long, it was about 45 minutes long or 50 minutes long, really had nothing to do with the requirements that the Financial Services Regulatory Authority put out. It didn't meet the requirements, but advocates said, hey, no problem at all. It's an eligible CE session. So it was kind of interesting. But my point being is you're going to get CE credits for attending today. You're going to get CE credits for attending future Zoomcast series. If you ever have a problem when you're applying for your license that for some reason these are not eligible CE credits, you just please give me a call personally, and I will talk to our friends at the Financial Services Regulatory Authority. So our Zoomcast series today is about knowing your corporate client, and we're focusing again on that profitable client with 1 to 5 employees. Our agenda today, we're going to talk about client needs analysis. We're going to talk about understanding risks and how to manage them. We're going to go through 4 case studies, 4 different sort of approaches to this. We're going to talk about reporting and accounting considerations and taxation considerations in 2023, which is important. Of course, a summary and questions and answers and discussions. And if you've got any questions or comments in the presentation, just throw up your little emoji hand raising thing, and we'll get to you for sure. As well as that, Mike, Rob, and Carrie are going to be monitoring the chat box. So if you've got a question or a thought or an idea and you want to throw it in the chat box, please do so, and Mike and Rob and Carrie will be certainly answering those things. Point of view. You know, it was interesting when I was putting these presentations together last year and revising them this year, with a couple of keystrokes on my computer, I found out that there are 449,770 businesses in Ontario. 440,000 of those businesses have less than 100 100 full-time employees. This is the landscape in Canada, without a doubt. When you've got all of these really small employers in the grand scheme of things, and there's so many of those things, so many of those employers in Canada. It reminds me of the story of Willie Sutton, the 1930s bank robber. He had two great skill sets. He knew how to rob banks and he knew how to break out of prison. He robbed about 60, I think it was 68 or 69 banks, and broke out of quite a few prisons after he got caught. And I remember hearing a story of one of the judges asking him, Willie, why do you rob the banks? Well, why do you rob so many banks? And his answer was, because that's where the money is. And quite frankly, when we're talking about group insurance and we're talking about employee benefits, without a doubt, I think where the money is in this particular business is with the 440,000 businesses with less than 100 employees. So that's really what we want to focus on through the Zoomcast series, is those smaller employers. And I think within those smaller employers, there's three distinct groups. 1 to 5 employees, sort of those really small cases, those 5 to 20 and 20 to 100. And the reason why I say that is that why they are distinct groups is because I think the buying decision is made differently in each of those particular groups, because as the group matures or as the group gets bigger, there's different processes in place and different things in place. So I think the buying decision is differently. Today, we're going to focus on that smaller size of the group, 1 to 5 employees, or as I like to say, you to a few. On Thursday, we're going to be back and we're going to be talking about a few to a bunch, or 5 to 20. And the next week, we're going to be talking about the larger employers, the 20 to 100. But really, there are endless prospects. And I think in that, of those 440,000 businesses with under 100 employees, easily 250,000 of those businesses or more have less than 5 employees. So there's really endless prospects. There are endless prospects out there. And the interesting thing that I found as well in my research is 75% of businesses with less than 5 employees do not have benefits. 75% of businesses do not have benefits. Now, you put that aside, and then you look at the survey that our friends at Benefits by Design did late last year, and 76% of new hires won't consider a job unless they have employee benefits. Excuse me. So you've got 75% of companies don't have benefits in this space. The 76% of new hires will not join a company unless they have benefits. So what I smell here, when you combine those two surveys, what I smell here is an enormous amount of opportunity. We wrote a lot of business last year, and a lot of that business that we wrote last year, especially in the smaller size, they have not historically had benefits. So they would be considered virgin groups, if you would. And they were putting these benefits in place because of the strain on getting new employees. So there's an enormous opportunity for all advisors out there, and it's time to take that into consideration. So as I was mentioning earlier, benefit purchasing decisions are made differently in each of these groups. And the question that I really want to answer in today's session is, how you can provide value-added service at a profit in this space with that you to a few. How can you provide value-added service at a profit, which is critical? And through this lens, we're going to explore. So that's what we're going to be talking about today. A little bit of a disclaimer. The Benefits Trust was started on January 1st, 1994. So we have been in business 29 years and 24 days. Our target market is we work with advisors like you. We do not sell direct. Many of the advisors that we work with are on the call today, and we thank you for your continued business. And if we're not doing business, we'd love to do business with you. We've got some very powerful offerings out there. So our target market is really working with advisors like yourselves with less than 100 employees. We do have quite a bit of business that is over that size, but again, our focus today is really that 100 or less. These are our views and our opinions. These are our views and our opinions, without a doubt, because this is our session. There you go. It is what it is, right? In this space, I've been doing this. I've been licensed since 1988, so well over 30 years. So I'm the one of the old guys in the room, and I would say that at least very conservatively, I've had over 10,000 sales meetings in this space. So this is what it is that I do. Without a doubt, this is what I do. I've got a lot of experience in this particular space. This is not a commercial for the Benefits Trust, nudge, nudge, wink, wink, but this is not a commercial for the Benefits Trust. But again, if we're not doing business together, we'd love to. And if we are doing business together, thank you for your continued support. So let's jump into things here because we only have 50 minutes left. Client needs analysis. Well, I think it's important to know where your client is going. You need to know where your client is going to determine what is the best way to help them, or more importantly, if you want to help them, you got to know where your client is going. And I think the best way to do that is you need to ask. You need to ask where your client is going. It's as simple as that. And it's interesting because, it's where you're going. It's like where you're going next on vacation, right? Like, for example, my friend Dan Caswell that's on the call right now, I know he's going skiing a couple of weeks with a group of guys, and they're heading out west. But if I didn't ask Dan where he was going, I couldn't give him any advice on where he was going. If I was saying, hey, Dan, you want to go on vacation? And I'm showing you pictures of resorts in Mexico, that's not really going to be very helpful. So I think what's important when knowing your corporate client is asking them future-based questions. You got to ask future-based questions to determine where it is that they are going. And I think the best future-based question that I've ever seen, and it's something that I've used certainly for the last decade or so, is a question that was created by Dan Sullivan from the Strategic Coach. And it's quite simple. If we were meeting here 3 years from now and you were looking back over those 3 years, what has to have happened to say they were the best 3 years of your life? You're putting your prospect or your client into the future. You're asking them to take a look back and say, what's happened over that past 3 years for you to say it's the best 3 years of your life? Now, it's really interesting. I use this question in sales meetings. I use this question with new prospects. I use this question with existing clients because you always want to know where your prospect or where your client is going. I use this question with my friends. I use this question at dinner parties. I use this question sitting around the campfire, so to speak. And it's amazing the results that you get. But if you ask someone where they're going and where they're going in the future for them to have the best 3 years of their life, it's amazing the responses that you're going to get. And the answer to this question is really going to give you a roadmap of where they're going. It makes selling easy when you ask a question like this. When you ask a future-based question, it makes selling easy. The answers will give you that roadmap of where they're going. They're going to be clear, they're going to be concise, and they're going to be very specific. They're going to tell you if the prospect or the client is going to tell you if they're going to grow, if they're going to sell their business, if they're going to merge their business, if they're going to retire, if they're going to enter into new markets or with new products. They're going to tell you what it is they're doing. And it's amazing some of the results that you get when you ask a question like this. The other thing that I like to say, if they don't engage, if they say, listen, I don't want to answer these questions. I just want you to give me a quote on my group insurance, like, hurry up and get out of my office. My opinion is if they don't engage, the answer is next. There's 440,000 prospects in this space, or 250 plus thousand in the 1 to 5 space in Ontario. And let's be clear, in Ontario means southern and central Ontario, less than a couple of 100 kilometers from the US border. This is where the market is. And if they're not going to engage with you and they're not going to tell you where it is that they're going and what they're going to be doing, my opinion is it's really not important to engage with them and waste your time. Because if you don't know, again, back to my comment about my friend Dan Caswell here, if I don't know where he's going, I can't help him out, right? It's as simple as that. So why would you want to deal with someone that you can't help? You're just shooting darts at a dartboard with a blindfold on. Simple as that. So understanding risks and how to manage them. So we understand where the client is going, right? We understand where the client is going. They've given a clear, concise roadmap. So understanding risks and how to manage them. One of the things that was a really big life changer for me was I was in a meeting with an advisor, advisor like you, and a client when we used to have those face-to-face meetings, so to speak. And it was really interesting because the meeting wasn't going well. You could see the client getting really frustrated. His arms are crossed like this, and he's sitting back in his chair, and it's just not going well. And I said, whoa, everybody just stop for a moment. Everybody stop. And I said, what is an employee benefit plan? And the prospect looked at me and he goes, it's what we're talking about here. What the hell are you talking about? It's what we're talking about here. It's this dental stuff and this drug stuff and the life insurance and so on. I said, no. And I have no idea where this came from. So if I stole it from someone and I don't give them credit, it's because I don't remember. But honestly, I don't know where it came from. But I said, no, an employee benefit plan is a promise between an employer and a group of employees. It's a promise between that employer and that group of employees. And the question is, what do you want to promise them? What would you like to promise those employees? And it was really interesting because the body language of this particular client changed. His arms were no longer crossed. He was sitting forward. The light went off in his head. And he goes, what do you want to promise them? And he goes, oh my God, I can promise anything I want. I'm the employer here. I'm the plan sponsor. These are my employees. I can do whatever it is that I want. And it's really that blank canvas that the employer realized. And he goes, man, I can do anything I want. And as I like to say, I like to think our job as an advisor is a translator, right? It's a translator. We need to translate our insurance language into English, something that they being the prospect understands. And these are the 2 points that I often bring up. And I said, what do you want to promise them? And there are 2 types of promises that you can make. One is a low frequency, high cost promise, and one is a high frequency, low cost promise. So let's explore those 2 for a moment. A low frequency, high cost promise, that is a promise that requires insurance. And often there are limited options available due to the size of the client with 1 to 5 employees. But you can look at things like group life insurance, group accidental death and dismemberment insurance, long-term disability insurance, critical illness, out-of-country emergency travel coverage, and stop loss for in-Canada claims. But these are examples of low-frequency, high-cost promises. So in other words, the chance of someone dying while they're employed in your organization is pretty small. It's minimal, right? But you're making a promise that is very high in costs. So I might say to an employee, hey, we're going to pay your named beneficiary $25,000 should you pass away while you're employed here at ABC Inc. If I'm making that promise of $25,000, and God forbid something does happen, I want to make sure that I've got the money to pay for that. And that really requires insurance. That's for catastrophic, sudden, unexpected events. So those low frequency, high cost promises require insurance. So when you use language like this and you show examples like this, clients, they get their head nodding. One of the things that my late father said to me is, talking about selling, is get your client's head nodding up and down. Yep, they understand that. That shows that they're understanding that. The second type of promise is a high frequency, low cost promise. And that requires budgeting for things like extended healthcare, prescription drugs, vision care, dental, healthcare spending accounts. Those are promises that are making that the chances are they're going to be very high in frequency of claims, but the promise cost is relatively low. So for example, I'm going to take the generic equivalent of Lipitor tonight for cholesterol management, and the cost of that is pennies a day. But my employer is making me a promise that says, hey, great, if you have a need for a prescription medication, we're going to take care of 80% of the cost, for example, or 100% of the cost, or whatever it is. But again, the cost is very, very low. So that really requires more budgeting than insurance per se. So again, using very simple language, that high cost, low frequency of event requires insurance, and those high frequency, low cost promises really require budgeting. So understanding risks and how to manage them, we've got a number of different products that are available to help clients with this, but more importantly, to make it easy. We've got the Smart Business Owners Benefit Plan, we've got Select Flex, and we've got a number of others, but it's about making it easy. It's about making it easy for the client to make decisions based on where it is that they are going. And the key thing about making it easy is you get to yes or no very quickly, and that means profitably. So if you understand where the client is going, because they've given you a clear, concise picture on their roadmap, right? They understand what the difference between high cost, low frequency items are and low cost, high frequency items are, and you understand what their needs are, right? You can make it really easy, and you can get them to say yes, or you can get them to say no very quickly. And that is often very profitable from your perspective. Because if you think about it, if you got a 4-life case and then you say, hey, let me gather your employee data, and you don't know where they're going, and then you get 47 quotes from all these different suppliers out there, and then you go back and present it to them, they're going to be more confused, and you're not going to be successful in putting these plans in place. And even if you are successful, you're going to be working for about $1 an hour. So you want to get to yes or no very quickly. Yes pays you, no teaches you, but that maybe kills you. So when you understand what products are available in the marketplace and you know where the client is going, you can put that product in place and saying, this is the best for you for these reasons. And it's no guessing, no game playing. And the best part about a lot of our products is the clients set their own budget. The clients set their own budget. So it makes it really easy for that client to say yes or no, because they're setting their own budget based on what their needs are and what their requirements are. So let's move into a couple of case studies here. We've got two business owners with different requirements, and they don't have any employees yet. So this is quite common. They, a company has started out. There's the two business owners. They're all full of piss and vinegar, as I like to say. They're ready to go, and they're operating their business. They don't have any employees yet. They're going to hire some employees in the future, but they need benefits. They need benefits. So in this particular case study, this particular client, the advisor was speaking with them, and they said, hey, great, the one owner needs family coverage, and they want a plan that covers all of medical expenses. Simple as that. They want a plan that covers everything, all medical expenses. The other owner, which is interesting, the other owner has a spouse that has coverage through their employer, but they have orthodontia needs. So little Johnny needs some orthodontia, but the spouse's plan doesn't cover orthodontia. So all of a sudden you got one employee or one owner that's saying, hey, I need all this coverage. I need all the medical and dental expenses covered. And the other employee says, I just need these specific medical expenses covered. So because this advisor was well aware of what it is that we do and what it is that it's available in the marketplace, it was really easy for this particular advisor to plug and play based on where it is that they're going. They put in the Smart Business Owner Plan, and if you want more information on the Smart Business Owners Plan, I know Mike or Rob or Carrie would be happy to help you with that. But it's a plan that we put in place that makes it easy for people to buy this type of coverage. So in this particular case, they've got $25,000 of group life insurance and AD&D for both plans, or both employees, pardon me, or both owners. They also have 90-day out-of-country emergency coverage, because that was one of their requirements, because one of the guys liked to work remote, and in this case, out of the country. So they wanted 90-day out-of-country emergency travel coverage. And then the principal owner, or the principal owner that we put in the sales division, has a 100% unlimited health and dental coverage. And then the Class B owner, that was one of the owners or principal who was in charge of the finance, or as I like to say, backstage, who has the need for orthodontia, we put in a healthcare spending account of $6,000 to pay for that orthodontia. So the best part about a healthcare spending account, especially if a spouse has a plan, is the opportunity to use the spouse's plan first and then the healthcare spending account second, because the healthcare spending account is always the second payer. So the result of this, and this was a one-meeting sale, the result of this is a plan was put in place for both owners, and it formulated something that made sense for them, because they both have that $25,000 of life and AD&D. They both have that 90-day out-of-country emergency travel coverage. The one owner has that 100% unlimited plan, and the other owner has the orthodontia taken care of, as opposed to just a plan that doesn't really work well for both of them. This plan is tailored specifically for them, and it's also got the engine, so when they hire additional employees, there's more flexibility in putting in different plans for them within this plan. So here's an example, or this is an example of a profitable case, an extraordinarily profitable case for this client. This particular advisor was in and out of this particular client or prospect within an hour, and had a group sale under her belt. So it was pretty awesome. There was a case study number 2. Does anybody have any questions on that, or thoughts or ideas? Please, again, pump them into the chat box, or just raise your hand or speak out, and we'd be happy to talk about it. Case study number 2. There was an owner with there was a business owner, one key employee, a couple of full-time employees, and one part-time employee. They had no prior coverage. Again, that Virgin plan, they were having difficulty hiring people, but budgeting was really important. Their business was relatively young, and budgeting was really important. And the owner wanted complete control over the expenses. The owner wanted complete control over the expenses, no surprises. So what was decided was to put in healthcare spending accounts for this particular organization, because healthcare spending account, the costs are set. There aren't going to be any changes throughout the year. And it was, so that was important to that particular client about their expenses being capitalized, if you would, so there weren't any surprises. So the owner and the key employee, they put in $7,500 for each of those particular individuals. And then the Class B employees were full-time employees with 2 or more years of service. And this particular owner, whether you agree with it or not, I've got different opinions on that, but whether you agree with it or not, the client made the decision that they wanted family coverage level to be $3,500 and single coverage level to be $2,750. A little bit of an advantage for the family employees, but that was, again, not our decision. That was the decision of the employer. And that was for employees with more than 2 years of service. New hires received $1,000 to healthcare spending account, and the part-time employees, and there was one part-time employee in this particular case, and they received $350 in healthcare spending account. Now, it was really interesting because one of the things that this particular advisor knew very well, especially with our solutions, is you did not need pooled benefits. You did not need pooled benefits to be included in their plan offering at this point in time. So there's no life insurance, there's no AD&D, and so on. Because one of the a number of the options that the prospect was looking at before this advisor came in included, group life insurance and AD&D and so on, and they really didn't want that at this time. So the result of this particular plan design, is there's cost containment. The client knew exactly what their costs were going to be, as well as that it was limiting their exposure to risk for new hires, because often there's high turnover with new hires. And in this particular case, they've only got $1,000 risk for those new hires. There was an employee retention component built in. There's an incentive to stick around, because after 2 years, then you get bumped up considerably or materially. And as well as that, for the owner, should the owner's expenses exceed that $7,500, there's an option for cost plus over and above the healthcare spending account. As well as that, we've got the ability to change their benefit plan to an unlimited plan at any point in the future, because it doesn't have to happen on an anniversary date. It can happen at any time throughout the year. So there's an opportunity and that flexibility that's built into place to be able to satisfy the owner's requirements as things go on. But what was really critical for this was the budgeting and the no surprises. So this plan was put in place. Again, a one meeting sale. Well, actually, it wasn't a one meeting sale. The concept was delivered. The budget was presented and set with an online tool. And then the client thought about it. And then I think about a week later, he said, look, great, let's move ahead. So it was really quite a great solution and very profitable for that particular advisor, because he was only out visiting that client once, and then got the paperwork done, and then went and picked it up. So it was quite profitable. Case study number three. This was a Virgin group. Again, a lot of Virgin groups in this area, because again, let me restate this. There are 250,000 plus employers. 75% of them in Ontario do not have benefits, but yet 76% of new hires need to have benefits. So a lot of companies in this space are putting in these Virgin groups, which is awesome, because it's just such an opportunity. But this is a Virgin group. The client really thought that they wanted a traditional style plan, but the broker didn't think it was a good fit and would understand ASO. We're an ASO provider to a great extent, but the broker didn't really want to spend a lot of time with this particular client. Initially, he wanted to put a solution in place that made sense, and they wanted that traditional style plan. So what was put in place in this case was what we call a Select Flex plan. It's an insured plan that we offer. There are very specific limits on it. It's a great way to start a Virgin plan. And again, if you want more information on SelectFlex, talk to Mike, talk to Rob, talk to Carrie. They'd be happy to help you out with that. Again, this was an online tool. The advisor was able to pull up selectflexbenefits.com. And again, maybe Mike or Rob, you can throw that right into the chat box, selectflexbenefits.com. But it included $25,000 of life and AD&D. Prices are already set. There was dependent life insurance for $10,000 for spouse and $5,000 for child. There was 20 per child. $25,000 of critical illness coverage. There was out-of-country emergency travel coverage. There was a prescription drug benefit with a drug card. That's a very limited benefit. It's only a $5,000 cap, but great for a Virgin case because you have no idea where claims are going to come into play. There was somebody I know that we were speaking with earlier. I can't remember who it was, but they were talking about they took over a plan and there was a Quebec employee with $38,000 or $35,000 worth of drugs. So when you're looking at a Virgin case, the advisor was presenting this and saying, hey, you want to put a limit on, especially from day one, because you don't know if somebody's taking a $30, $50, or $100,000 drug. So this SelectFlex option was very appealing because they didn't want to necessarily open up Pandora's box, so to speak, and then be stuck. So there was this prescription drug benefit that was put in place with a drug card, as well as that semi-private hospital room coverage and some basic dental. As well as that, the manager or the owner in this particular case they were able to add a $1,500 healthcare spending account because of some of the limits that were built into that SelectFlex benefits. So again, check out selectflexbenefits.com and check it out. But the best part about this particular client, again, it was the one meeting sale. It was quoted on the spot, and he got to yes very quickly. Again, it was the advisor pulling out his laptop in this case and understanding where the client was going, understanding what their needs are, because he asked the question and it says, great, we've got a fantastic solution for you. Let me pull it up. They were flipping through it and they were talking about it. And then he goes, let's build the quote right on the spot. Because the first thing a client says is, this is great, but how much does it cost? And then you say, well, let me go back to the insurance companies. No, this was done on the spot. And it got to yes very quickly. And the idea was this was an initial start. And after a year or two, the client has a better understanding of benefits because this is the first time they've had benefits. And we're going to have some claim experience. And then they can look at fully customizing and benefits and moving to more of an ASO type of platform as the company grows. So this was a great first step. This was a Virgin case. The client didn't know how much time he was going to spend with the client. He didn't really want to spend a lot because it was a small case, but he got to yes very quickly, which was profitable. And it was done in one meeting sale, and it was done on the spot. So it was a great solution. So again, check out selectflexbenefits.com. Our last case study in this particular space. Sorry, does anybody have any questions? I know I'm going through this really quick because I've had 2 cups of coffee and I'm, just a little wired here, right? And by the way, I'm in British Columbia right now, so it's only 7:33 in the morning, and it's a little early. But, anyways, this is something that we see a lot, a fair amount. This is a 4-person case. Sorry, we didn't put that in there, but the client just wanted us to match their current plan design because they have received renewals from their existing traditional insured plan with one of the major insurance companies. And they realized that they had a fairly basic plan. They had, sort of that 80% level. And they realized that their plan experience, their loss ratios were in that sort of 50 to 60% range, yet they were still getting increases in price. They're still getting increases in price because their credibility was really low and the pool was doing poorly, and the insurance companies were, hammering these renewals through with small increases. But the client's sitting there and he's frustrated. The client's frustrated and he's going, I don't get this, man. I don't get this insurance thing because I buy this plan, I put it into place. It's an 80% plan. It's supposed to be good for everybody, right? And I'm paying 50 cents on the dollar and I'm getting reimbursements back, but half the stuff that I put in as the business owner isn't covered. So again, in asking the questions on where the client was going, money really wasn't the ultimate issue here. It wasn't the driver, it was value, right? So the advisor, heard what the client was saying because he asked where the client was going, heard what the client was saying and said, hey, let's look at things a little bit differently. Let's look at things a little bit differently. So what they did was they put in place, somewhat of a foundation to match the existing coverage, but they made a couple little tweaks to it. And they had $25,000 of the life insurance in place, and they kept that in place. But one of the things that they did is they added, instead of $25,000 of AD&D insurance, they increased that to $100,000 of accidental death and dismemberment insurance. And the reason for that is one of the owners had a family friend that died very unexpectedly, and it caused, I don't know if anybody knows anybody that's died really unexpectedly, and it's very tragic and it's very jarring. And his philosophy was, if somebody died while employed in their organization unexpectedly, he wanted to be able to deliver a meaningful check. So in this particular case, if somebody died unexpectedly, instead of delivering a $50,000 check, they were going to deliver a $125,000 check. $100,000 for the AD&D insurance and $25,000 for the life. The AD&D insurance is pennies. So it was decided to increase that accidental death and dismemberment policy. They also included $25,000 of critical illness. One of the things that's interesting in this particular case is they didn't have long-term disability, but the amount of long-term disability you can get for a few employees is pretty limited. It's maybe $2,000 a month in benefit, $24,000 a year. And it's expensive. So what the client said is, if somebody gets, one of the big diseases, a cancer, stroke, heart attack, whatever it is, he wants to be able to deliver a $25,000 critical illness policy, or a $25,000 critical illness check, not a policy. He wants to be able to deliver the check. And then out-of-country coverage was certainly important. As well as that, using the same rates that were put in place, we put in 100% unlimited plan for health and dental coverage for the owner. 100% unlimited, no co-insurances, no net maximums, no deductibles. The plan was already overfunded because they had a 50% loss ratio or 60% loss ratio. So it was decided that the owner would put in this 100% coverage for himself. Again, no limits, no maximums, no co-insurance, no deductibles, and use those same rates as a budget, right? And then be able to cover 100% of their expenses, so the employer is not reaching into their pocket and paying with after-tax dollars for things that they're going to buy anyway. The full-time employees had the same health and dental plan that they had previously. So back to the owners with 100% dental coverage, one of the things that, or 100% health and dental coverage, one of the things that was interesting, and the example that I always use is these glasses, right? These glasses. I went to see, as I call them, Shaky Dr. Creaser. Yeah, went and saw Shaky Gord right on Monday morning. It's a friend of Dan's and mine. But anyways, I went and saw Dan's neighbor actually, and he was probably out drinking way before that. Steve, hold on one second. I'm going to get to your question in just one second. But I got these glasses, and the glasses were $600. So I went and saw the doctor, the eye doctor. Said, you need glasses when you're looking at your screen. And I said, great. It's the only time I need them. And I picked out these particular glasses because they make me look like, a rock star. And I said, I want to have 3 pair. And the lady that was helping me, Dr. Creaser's assistant that was helping me, said, geez, do you realize they're $600 each? And I said, I understand that. And he goes, well, that's going to cost you $1,800. And I said, I understand that, but my benefit plan covers that, because I'm going to buy these glasses and I want a pair of glasses for my office. I want a pair of glasses for my home office. And I want a pair of the glasses that I can put in my briefcase, so I always have them. So if I'm out visiting you in one of your offices and I'm using my computer, I always have glasses with me. I never have to be looking for them or forget them somewhere, because I'm a forgetful kind of guy, right? So all that is a tax deductible expense to my business, and I receive it tax free through my benefit plan. So that 100% health and dental really resonated with this particular owner. So the current Plan design was kept in place with a little couple of tweaks. The owner now has that unlimited coverage, and there was still some significant savings even with the improved benefit plan for the owner. Stephen, question. Press unmute. There
Yeah, my question is, so obviously from what it sounds like is the ownership class or the owner was responsible for the high experience of this group. They were probably one of the bigger abusers. Wouldn't it have been smart to put in a healthcare spending account?
Well,
and lower some of their coverage to compensate?
Well, again, a couple of comments on that, and that's a great question, and thank you for bringing that up. First of all, I never think that anybody's an abuser of a plan. They're either using it or not, right? And they're using it, generally speaking, for medically related expenses. The business owner wasn't necessarily abusing the plan. He was just reaching into his pocket for things that weren't covered under his existing plan. So things like he needed a crown done, for example. I don't know if this was the case because I wasn't involved specifically with this sale, but a business owner might need a crown done, and if they only have basic dental, then it's not covered. So the owner's sitting there going, I'm paying all this premium, but anytime I want something covered, like a crown, it's not covered, so I'm paying for that out of pocket. So the owner's sitting there writing a check every month, but he's not getting much back. So it's not necessarily the owner abusing the plan, quote unquote, right? It's just saying the owner was saying, hey, I want to have 100% coverage for all of these things because I don't want to have to reach into my pocket and use after-tax dollars. The idea of the healthcare spending account is a terrific solution, and we used that in one of the previous examples because they wanted budget certainty, right? But this particular client wanted the existing plan to stay in place for the employees. He just wanted that 100% coverage for himself. The money's not the issue. Like using the example that I just used, the $1,800 for the 3 pairs of glasses or the 2 CPAP machines I have or whatever it is, right? The money's not the issue. It's the tax effectiveness of the plan that's the issue, right? So for example, like I said, the 3 pairs of glasses, I wanted those 3 pairs of glasses. I was going to buy those 3 pairs of glasses, whether I had benefits or not. If I sold polished widgets and wasn't in the benefits business, and I was very successful at doing that, I would be buying 3 pairs of glasses. That's not a question. The question is, what's the best way to pay for them? And this particular advisor was sitting there going, my previous plan didn't give me any value. I want a plan that gives me value. The client the advisor understood where the client was going, understood because he asked those questions. He said, what are your frustrations? And the frustrations were, I'm not getting any dollar value out of this or any real value out of this. And I want to put a plan in place that gives you value. Right. So that's how it was sort of approached, and that's how it worked. Does that answer your question? Thanks. Doug, welcome. Good to see you.
Well, just following up on Stephen's, typically, in a lot of cases, the plan is shared 50-50 cost with employees, right?
Sometimes.
So I guess in this case, if it was cost sharing, the employees would be subsidizing the owner's rich benefits.
You know
So
what?
you might want a health spending account in that case.
Thanks, Doug. Thanks. I really appreciate your comments there because you brought up a great point where if it's a 50-50 cost sharing, if it's a 50-50 cost sharing, yes, sometimes the employer or the employees are subsidizing the employer or the owner's claims for sure. But a lot of times what we find is we're rating, especially after year 1, we're rating the Class A experience different than the Class B experience and setting rates. Even with 4 employees, we're setting rates differently for the employees and differently for the owner to prevent that type of thing from happening. But this is where the flexibility comes into place. This is where the flexibility comes into play when you're understanding where the client is going and understanding a solution. And in this particular example, what was really important to the client was value. Right. And it was tax effectiveness of buying the things that they were going to buy anyway. And they just wanted more dollars being used to pay claims and less dollars being used in the insurance company's hands with those 50 and 60% loss ratios. So again, we can talk more about this, in the future, but when you find those plans where when you look at the experience and they've got 40 and 50 and 60% loss ratios, it's best to send them to us. Rob, you had a point you wanted to bring in?
Yeah, thank you. We've also set these unlimited plans up for, say, partners of a law firm or for an accounting firm. And then at the end of the year, we can send a utilization report showing how much each partner spent. We're not going to give the individual claims because that's protected under privacy, but we will kind of give a utilization report so they can go, partner A spent 20, partner B spent 5, partner C spent 15, and then they can do their own kind of an internal accounting based on that to kind of make it all true at the end of the year. So we're very customizable that way. And then we could definitely kind of help the corporation make it equal at the end with their own internal accounting and could provide rates or reports on that.
So it's really understanding. You brought up a great point there. Thanks, Rob, for sharing that. I appreciate that. But it's really understand, and this is the idea of this. Back to the title of this particular presentation. It's know your corporate client, right? And it's knowing your corporate client, knowing where it is that they want to go, and helping them get to where they want to go. And if it's a partnership, like Rob was suggesting, we can offer these 100% plans with, utilization reports and so on. Or in this particular example, it's, the client wants his crowns covered and he wants his glasses, or he wants his, knee braces covered, whatever the circumstances are. But it's just in this particular case, it was just a value play. And the value play was about tax effectiveness, and then keep the current plan design because the employees were fine with it. If it ain't broke, don't fix it, right? So they wanted to keep the same plan design. A little bit of a tweak in the AD&D component, because that's something that the client wanted. We've got a few minutes left, but reporting and accounting considerations. I'm not expecting you to look at this report and look at all the numbers on it, or I'm just showing you this as an example. But this is something that we send out to every single client and every single advisor every single month for all plans, with the exception of that Select Flex plan. We can talk more about that offline. But this is just a receipt. It's a sales receipt. You walk into Costco or you walk into, Metro, and you buy items and you get a sales receipt. This is just a sales receipt. The first column is current month. So the client in this particular example, let me blow it up a bit. The current month, the client gave us $7,201.21, for life, AD&D, LTD, etc. We paid out to the insurance companies $1,402.48 for the pooled benefits, those high cost, low frequency items that require insurance. In claims in this particular month, in various categories, we paid out $4,109.32. We paid out plan operation expenses, which includes your commissions, and the client in this particular example has a surplus of $719.09. Again, no surprises. The client knows exactly what's going on. This is sent to the client every single month and sent to you, the advisor, every single month. So you see exactly where a client stands. The second column is year-to-date cumulative, so they can see where they are on an ongoing basis, on a year-to-date cumulative basis, and after 12 months, a previous year-to-date cumulative basis, so they can see where they are. Client owns any surplus and the client owns any deficit. So Stephen, back to your point. If all of a sudden the business owner was the abuser, quote unquote, right? And there's a negative balance in their account, right? Because they went out and bought 3 pairs of glasses or 2 CPAP machines, or went to MedCan with him and his spouse and 3 children because they don't have a family doctor, and they paid $10,000 for the 5 of them to go to MedCan, right? Fantastic. They're in a deficit and they owe us money. And then at the next renewal, we budget that in, we budget that deficit in, or take into account that surplus to set their rates going forward. And then back to Doug's point, if the owner has a great deal of benefits, we can rate the cost of that according to the owner's benefit class if they want, and then the employee's benefit class is separate. And again, we're doing this with 4 employees, right, or as many employees as the client has. So this particular report here is critical, and it just keeps everybody on side. It's it's a monthly, it's a what it is. It's a monthly experience report, and this is for groups of 4, so there aren't any surprises. That client in this previous example That client got a huge surprise. That client got a huge surprise. And why this advisor, this new advisor, was in there and replaced that plan is because that client got a huge surprise when the renewal was delivered, and the renewal was delivered with a 50% loss ratio. The client's going, WTF? I paid $100 and I got $50 worth of value out of it. That's not good spending. That's not good value, right? It might be in some people's eyes, but in this particular advisor or client's eyes, it wasn't. So the advisor asked those questions. Where do you want to go? What's important to you? Where are you going? Like, where are you heading? You're growing. Money's not the issue. Value is the issue, right? It's not about the lowest price necessarily. It's about having the right solution in the right place for the right time. Tax considerations. Steve Foreman raising your hand again. How are you, Steve?
I'm good, Robert. So what you just showed shows that their potentially ugly experience just followed them over to, benefits trust, and now they have to top up their bucket to the tune of just over $7,000, right?
In that example, yes.
In that example. Again, furthering to my why wouldn't you just, if you've asked the questions and you see it's the owner needing the $1,800 in prescription eyewear, the multiple CPAPs, the Medcan, crowns, caps. Yeah, that's why, again, you'd put on that healthcare spending account for them.
But I hear what you're saying, but a healthcare spending, first of all, it's not crappy experience. There's no such thing as crappy experience. It's
okay,
just,
I should rephrase that.
It's just experience, right?
It's just experience.
So
and they're using the plan as it's designed to be.
Correct. Now, what happened? Now, from the owner's perspective, again, it's about a tax play, right? Because right here on thank you very much, Stephen. Right here, tax consideration. All benefit plan costs are tax deductible business expenses, right? So update 2023. This is a new year. This is a new CE session, right? Update on tax considerations. It hasn't changed. There's the update, right? So all expenses are tax deductible business expenses. Stephen, what is the difference? And everybody on the call, I'm not pointing you up, but what's the difference between a healthcare spending account, right, and an unlimited plan? The answer is nothing, except one has a cap on it and one doesn't. It's either pay now or pay later. So using that example of $10,000 of experience going to Medcan, let's just say we had a $7,500 healthcare spending account for my $1,800 vision care and my 2 CPAP machines and my custom knee brace, and I use all that $7,500 up, and then all of a sudden, in my case, my doctor retired, and I had no family doctor, and all of a sudden it was time for our regular checkups, and I have no family doctor, and then I decided to go to Medcan, and I have a $7,500 healthcare spending account. And during the year, I've already spent $7,500 bucks. Now I got a $10,000 expense that I'm reaching into my pocket for, and that's costing me $20,000. You see where I'm going? Now, all of a sudden, I've got this unlimited plan. I go and spend $10,000. I get reimbursed for that $10,000, and my plan's in the hole by $10,000 bucks. Okay, fantastic. I know I'm going to make that up next year. It's not crappy experience following, it's just experience. Right? So benefit plan costs are tax deductible business expenses. These are for things in this example that the owner was going to buy anyway, right? He just didn't know what all of his expenses were going to be in the next 12 months, right? So benefit plan costs are tax deductible business expenses. Extended health care and dental care benefits are received tax-free by the employee, the plan member. For the business owners, we recommend that those 100% plans are strongly recommended because, again, this is for sick rich people, right? As I like to say, the business owner, the business owner wants that 100% plan in place because they just want to make sure that everything is covered so they don't reach into their pocket. Every time you reach into your pocket and pay for something, right, it's after-tax dollars. I know Eldon was talking about, he had a picture of his fireplace up earlier, and I'm not sure if it's still up because I'm not looking at the whole screen, but he's talking about the cost of gas going up, right? That's after-tax dollars, right? If you can show your client a way that they can pay for things, and the list is vast, pay for things with tax-effective dollars, you're adding value. You're adding value. It's not your job as an advisor to show them the cheapest solution. Your job as an advisor is to show them the best solution that's profitable right? It's as simple as that. It's the best solution. And for a business owner, sometimes healthcare spending accounts are recommended, especially if the spouse has a plan. If the spouse has a plan, healthcare spending account is always the second payer. But in the previous example, I think it was the second example we used, the client really wanted budget certainty, right? He wasn't ready for this particular type of plan yet. So yes, Stephen, we did put in a healthcare spending account, but we know that we can morph it into something more appealing once he gets a good understanding of where his expenses are. So in summary, with 5 minutes left, understanding where your client is going is the most critical thing. Forget about what's happened in the past. Ask your client where they're going. And the simple way to do that is if we were meeting here 3 years from today and you were to look back over those 3 years, what has to have happened for you to say it's been the best 3 years of your life? Ask your client where it is that they're going. And this question works. And what I suggest that you do is try it out. Try it out. There's 250,000 prospects out there. Try it out. See how it works. Try it out with your friends. Try it out at a dinner party. It was interesting. I was at a restaurant in Aurora, and I think there was 10 of us. There was 5 couples, and all the guys were sitting at one end and all the girls were sitting at the other end, and the girls were talking about their purses or whatever girls talk about at these dinner parties. It was crazy, but the guys were all sitting at the end of this particular table, and it was fantastic because I asked this question, and these are all my friends, and I asked this question, and one of the guys said at the end of the dinner, he goes, "That was one of the most meaningful conversations I've ever had." And it was fascinating because it's just such a powerful question that sees where you're going in the future. Look at a benefit plan as nothing more than a promise between an employer and an employee. Our job as advisors is to translate often into English that the client understands, right? And when you use that word promise, it's a very powerful thing. If I'm going to promise something to somebody, right, I'm putting my word behind it. Paul's with us today. Paul's in Thornhill, I think you said, Paul, right? Where are you, Paul? Oh, you got your mute on there, bud. But anyways, Paul, if I'm going to promise you something, I'm putting my word out there that I'm promising that this is going to happen, right? It's a very powerful thing, right? But it gives me the power to say, hey, Paul, I'm going to promise you this, or I'm going to promise you that. But a benefit plan is nothing more than a promise between a group of employers, or group of an employer and a group of employees. The other thing that it's important to note is the monthly report that we create provides it provides that opportunity to eliminate surprises. It eliminates surprises completely. And the other thing, and Stephen, I thank you very much for asking some tough questions there, but that 100% plan work, or the 100% plans work for owners and executives. So it works out extraordinarily well because it's just a tax effective way to pay for things that you're going to pay for anyway. Simple as that. So we've yucked it up for an hour here. Hold on a second, let me go over here. We've yucked it up for an hour here. Questions and answers, discussions. I'm going to stop sharing the screen right now, but make sure you visit thebenefitstrust.com. Lots of powerful stuff on there. Let me just stop sharing so I can see everybody again. There you all are. Over 50 people on the call. Awesome. Thank you very much. So we're going to stick around for a few minutes because I know people have to go because it is 11 o'clock. I promised 11 o'clock that we would be done. I promised 1 hour. And I appreciate the time that you've spent with us today. On behalf of all of us at the Benefits Trust, we want to thank you for your time. In addition to that, you are going to receive a CE credit for participating today. Mike's going to send that out momentarily, the next week or 3, and you will receive a CE credit. If you ever have a problem with any of our CE credits, you just call me because I'm going to bless the Financial Regulatory Authority. As well as that, we want to recommend that you fill out the survey because we want to know how we did today and how we can do it better tomorrow. Simple as that. And if you want to stick around and answer any specific questions, be happy to answer any specific questions. And if we're doing business together, thank you. And if we're not doing business together, my goodness, would we love to do business with you, because guess what? It's 2023 and we have some inventory on the shelves. So we're not sold out yet. We've got some inventory on the shelves, so we'd love to do business with you. So thank you very much for your time. I'm going to stop recording now. Have a great day, and we'll see you soon.